अस्सलाम वालेकुम एवरीवन, वेलकम बैक टू माय यूट्यूब चैनल। अब यहाँ पर हम बात करते हैं नेशन की। द नेजन इज़ द डिप्रेशन इन द मिड लाइन ऑफ द नोज़, यानी कि नोज़ की मिड लाइन में जो डिप्रेशन होती है उसको हम कहते हैं नेजन। उसके बाद हमारे पास यहाँ पर एक्सटर्नल ऑक्सीपिटल प्रोट्यूबरेंस आ रही है। दिस इज़ अ बोनी prominence in the middle of the squamous part of occipital bone. It lies in the midline at the junction of head and neck and gives the attachment of the ligamentum nuchae, which is a large and that runs downward and connecting the skull to the spinous process. A line joining the nasion to the external occipital protuberance over the superior aspect of the head would indicate the position of the underlying structures such as falx cerebri, superior sagittal sinus, and the longitudinal cerebral fissure and separate the right and left hemispheres. Now, talking about the vertex, vertex is the highest point on the skull in sagittal plane, anterior front tail. In the baby, the anterior frontal lies between two halves of the frontal bone in front and two parietal bones behind. It is usually not palpable after 18 months. Posterior frontal. In the baby, the posterior fontanelle lies between the squamous part of occipital bone and posterior borders of the two parietal bones. It is usually closed by the end of the first year. Superciliary ridges. The superciliary ridges are the two prominent ridges on the frontal bone above the upper margin of the orbit. Deep to these ridges on either side of the midline, the frontal ear sinus, superior nuchal line. The superior nuchal line is a curved ridge that runs laterally from external occipital protuberance to the mastoid process of the temporal bone. It gives the attachment to these structures. The mastoid process projects downward and forward behind the ear. It is underdeveloped in the newborn child and grow only as the result of the pull of the sternocleidomastoid. As the child moves his or her head, it can be recognized as a bony projection at the end of second ear. Auricle and external auditory meters. These structures lies in front of the mastoid process. The external auditory meters is about 1 in 2.5 centimeter long and forms an S-shaped curve. To examine the outer surface of the tympanic membrane in the adult with an otoscope, the tube may be straight by pulling the auricle upward and backward. In small children, the auricle is pulled straight back or downward and backward. Tympanic membrane. The tympanic membrane is normally fairly gray and is concave toward the meatus. The most depressed part of concavity is called umbo and is caused by the attachment of the handle of the malleolus on its medial surface. Zygomatic arch extend forward in front of the ear and end in front in the zygomatic bone. Above the zygomatic arch is temporal fossa and is filled with the temporalis muscles. अगर यहाँ तक आपका कोई भी सवाल है तो ज़रूर पूछ लें। इजाज़त चाहूँगी। अल्लाह हाफ़िज़।